Did you know that the number one cause of death among Australians is very preventable? Cardiovascular disease is not only preventable but treatable, however you need an accurate diagnosis. Welcome to Explain, a series where we demystify medical imaging so you're empowered with the knowledge to make informed decisions about your health. Cardiovascular disease includes a group of conditions which can be detected by a simple medical imaging test. These tests look at your heart health to help your doctors assess your risk of heart disease and other heart issues. There are different types of tests depending on your symptoms, including echocardiogram, CT calcium score, CT coronary angiogram, myocardial perfusion imaging, and cardiac MRI. An echocardiogram, also called an echo, is a non-invasive exam that uses ultrasound to image the heart. Echo is often the first imaging test done while investigating cardiac conditions. The exam provides live, detailed images of the heart muscles' function and valves, giving a highly accurate assessment of the overall health of the heart. During your exam, the sonographer will apply a layer of gel to your chest to ensure good contact between the skin and the ultrasound transducer. You may be required to move into different positions or hold your breath so our team can make the best images. A CT calcium score is a non-invasive test that visualizes, measures, and reports on coronary calcification and calculates your calcium score. A high calcium score correlates with a moderate to high risk of a coronary event or heart attack within 2 to 5 years. During this exam, our team will ask you to lie still on the CT machine and hold your breath for a few seconds whilst the image is being taken. Our team will ensure you receive the smallest radiation dose possible during the exam. The complete procedure usually takes 10 to 15 minutes. CT coronary angiography is a low-risk, low-radiation, non-invasive exam of the coronary arteries. It can accurately detect any issues with the coronary arteries and show any irregularities in the coronary vessels. For this exam, you'll lie as still as possible on the CT table in a position that enables optimal view of your heart and arteries. You might be asked to hold your breath briefly as images are taken. While the length of the examination varies, you should expect to be with us for at least 30 minutes. CTCA itself is not painful, however you will need an injection of a small dose of X-ray contrast through an arm vein to enhance visualization of the vascular tissue and arteries. Because the contrast media shows the blood flow in organs and soft tissues, it provides further information about the area. During the injection, you may notice a sensation of warmth and a metallic taste or smell. These sensations will quickly subside. Myocardial perfusion imaging, also known as MIBI, uses a gamma camera and a radioactive tracer to evaluate the muscular tissue of the heart's blood flow during both periods of rest and at the peak of exercise. MIBI assesses the efficacy of the arteries supplying blood to the heart muscle, identifying whether they are unobstructed, partially blocked, or completely blocked. There are two types of myocardial perfusion: exercise and pharmaceutical. With an exercise test, the blood supply is made visible to the camera by the introduction of a small amount of a radioactive tracer injected into an arm vein. The injection is given during exercise on a treadmill and then again while resting. The pharmaceutical test makes the blood supply visible to the camera using a small amount of radioactive tracer injected into an arm vein. The injection is given during stress and then again while resting. The heart is subjected to a stress test using a pharmaceutical called personalised as an alternative to exercising. After each injection, a gamma camera placed over your chest takes images of the pattern of the tracer accumulated in your heart's left ventricle. This information is useful in diagnosing and managing conditions such as coronary artery disease, infarcts, and the diseases of the heart muscle. These images are usually combined with a low-dose CT scan performed at the same time on the same machine. This combined SPECT CT scan improves the accuracy of the information obtained and adds only a few minutes to the procedure. After the first scan is completed, the technologist will inject more tracer and ask you to wait, resting from 30 to 60 minutes before repeating the scan to show the heart at rest. Please allow up to 4 hours for the entire procedure. Radiation from the injected tracer diminishes quickly after the procedure, and you'll be free to go about your day as normal. Magnetic resonance imaging, also known as MRI, uses a high-strength magnet and radio waves to scan the body and produce images. Cardiac MRI is imaging relating to the heart and how it's working. The scan will take 45 to 65 minutes to complete and no special preparation is required. Before the procedure, you will be given an MRI safety questionnaire to complete. During the procedure, ECG dots and leads will be placed onto your chest to measure and monitor the heart during the scan, and a cannula will be inserted into your arm so a contrast agent can be given during the MRI. A lightweight blanket camera will be placed on your chest to acquire MRI images, and you will be required to hold your breath multiple times during the scan.